Every night at 6 p.m., we are taking a deeper look into the impact of the coronavirus. And tonight, I am joined by Carmen Moyers, a clinical dietitian with Huntsville Hospital. Thank you so much for being with us.
Thank you for having me.
With food shortages and prices on essential products rising, some people will have to buy substitutions for their meals, especially for certain types of meat. So what are some good substitutions that people can turn to?
So anytime you go grocery shopping, I highly recommend going with a plan, which sounds counterintuitive to having shortages and not really knowing what's going on at the grocery store. But your plan can be very open to changes. So for an example, a meal plan could be pasta on Mondays, tacos on Tuesdays, and casserole on Wednesdays. And then once you get to the store, you can see what kind of pasta do they have and what kind of toppings do they have. Tacos for Tuesday, maybe you normally have ground beef, and this time it's going to be fish tacos or chicken tacos or bean tacos, but you can always substitute almost any ingredient in some of those framework recipes.
That's good advice, and we're hearing a lot of people pick up the trend, meatless Mondays, and maybe going just at least one day during the week without meat. Are there any products that people should maybe avoid for their substitutions?
There's not really any particular things to avoid. As long as you're having a variety of foods, you're going to be getting the nutrition that you need overall. And there are a lot of options. You can get canned fish, canned chicken, cheese, eggs, canned beans, dry beans. My favorite personally is lentils. I feel those are very underutilized. Seeds, nuts, and nut butters. And if you want to get adventurous, you can even go to the vegetarian section and get tofu and tempeh and some of the meat substitutes. And those do not taste just like meat. So as long as you approach them as a new food that is going to taste different than something you've had before, you may enjoy it, and it adds a lot of protein and other nutrition to the meals that you have.
That's a great recommendation. Tofu is a great option, and you can really season it to taste however you like. Do you think people should expect to make decisions based on shortages for an extended amount of time?
I would just plan on going week to week. Right now, we go to the grocery store once a week. We pick up everything that we need for the week. Honestly, that's not much different than what we were doing before. And see what's available. Work with what you got. A lot of people also have pantries that have stuff in them that they haven't used in 6 months, and you can dig into your pantries and say, hey, let's go like we're on an episode of Chopped and see what we can pull out of our pantry and throw in here. As long as you're getting enough food in general, you're gonna be all right.
And I like that suggestion. Have some fun with it. You know, new research shows a major jump in food insecurity because of the pandemic. The Hamilton Project, it's a policy research firm, says a survey shows houses with children under 12, nearly 1 in 5 children aren't getting enough to eat. So what are the long-term health impacts of that?
There are a lot of long-term health impacts that are really unfortunate, especially when kids are not able to get their nutrition. And the same goes for adults. If you're not eating enough, your body does some amazing things to keep you going, but it's not always the greatest in the long term. It'll definitely keep you going in the short term, but it does increase your risk of malnutrition, which increases your risk of your immunity not being as strong if you were to get sick with any kind of illness.
Would including a multivitamin into your routine help at all with that?
As long as you don't have any contraindications from chronic illnesses, a multivitamin isn't a bad thing to include. Right now, a lot of people are also panic buying those, so some of them are hard to find in the grocery store. And if you are choosing a multivitamin, look at what's in them, because a lot of multivitamins don't actually have all the vitamins in them. Like gummies, most people don't know they don't have any iron in them, and iron is the most common nutrient deficiency for growing children.
Good to know. So what is the proper combination of a multivitamin that we should be looking for? What components should it have?
As long as it has vitamins and minerals, and a variety of those, you should be all right. It's just some of the gummies they're marketed as multivitamins, and they do have multiple vitamins in them. So it is quite literally a multivitamin, but it doesn't have those minerals and those common minerals that you see on food and nutrition labels, like the ones vitamin C, vitamin D, iron and calcium. You see those on most all your normal nutrition labels, and the reason that those are there is because those are the ones that we really need to focus on and make sure we're getting enough of.
One of the biggest debates in Washington right now is whether to increase food stamps benefits. And in your experience working with families, is the average family on food stamps able to cover their food needs and get the healthy food they need?
There are a lot of issues that go into that. I used to work in Detroit and the WIC program, and I saw very often that people's food stamps did not reach the end of the month for a lot of different reasons. Some of that is education and not knowing how to use your food dollars very well. Some of that is, even if you are on food stamps, you're working full time and you don't have time to spend an hour cooking from scratch with the cheapest ingredients. Or your family didn't teach you how to season all of these different foods and they turn out bland and terrible. So practicing cooking and practicing those things, it takes a lot of time and education that not everybody has access to.
Yes, that's true. YouTube has been a great resource for that lately. You know, coronavirus has affected people's daily routine, and whether it's exercising or eating, how can people in this circumstance maintain healthy habits?
The thing that I would focus on first is stress. Any way that you can reduce your stress is really important, because even if you are stressing about eating all the right nutrition and getting just the right amount of vitamins of this, that, and the other, and it is bringing your stress levels up here, that's reducing your immune system more than any amount of vitamin C can help with. So making sure you're not overly stressing about things, especially things you can't handle, or not handle, things you can't control. Just letting those go and seeing what you can control. A lot of the nutrition stuff you can control, and you can get affordable versions of fruits, vegetables, and try new things, add some variety in there, but it doesn't need to be the point where you're stressing yourself out over it.
Yeah, so cut yourself some slack, it sounds like you're saying. A lot of people rely on gyms to get their exercise. We know they're closed for the time being, so what are some ways that people can stay active at home or in areas where they feel safe?
There are a lot of celebrities that do exercise routines and are streaming those for free right now. I really love home routines that have different things, and you don't have to have weights at home. You can use the canned beans that you bought since there's no since you're trying something new. Use those canned beans as weights and use those while you're exercising at home. Having a dance party with your kids or something along those lines that's fun and enjoyable and relieves stress instead of making you worry whether you're doing your squats right.
Yeah, great advice. Again, just going back to having fun with it. I love the suggestion. Have a dance party with your child at home and they'll enjoy it too. We're going to take a quick break now, and coming up, how local organizations are making sure that no one goes hungry during this pandemic.